So we're going to start this off with explaining the patient. The patient's going to be an elderly man. His wife came in with him. He has COPD. He has verbalized and told me that he doesn't really understand um, how to work his MDIs and DPIs with a spacer and stuff, as well as told me, well, his wife told me that she smokes. So, hi, my name is Evan Swanson. I'm going to be a registered respiratory therapist today. I'm going to walk you and your wife both through the COPD management plan. My goal is to help you understand what COPD is, how your treatment works, and what you can do to help keep your lungs as healthy as possible. I'm going to talk to you over the barriers that we've already discussed and might make managing your COPD harder, and together we're going to overcome them. Do you have any questions? No? By the end of our time together, you will understand your disease better, feel more confident managing your symptoms, know how to use your inhalers correctly, and have a clear plan for monitoring your breathing at home. During this time, we'll also set up some SMART goals to help you stay on track and make it a little bit easier to keep track of everything. Let's start with COPD. Do you know what COPD is and what it does to the lungs? Not really? So, COPD causes a long-term inflammation in the airways. Over time, the tubes that carry the air both from your mouth down your trachea into your lungs become swollen. Inflammation in your airways. Because of that, air gets trapped in your lungs and it becomes harder to breathe out. And that is why you feel shortness of breath, you're tired, and you know how you've explained that you've been coughing a lot and you have a lot of mucus buildup. That's what that's from. Symptoms happen because the airways are narrowed, mucus builds up, and your lungs stay overinflated. Your breathing muscles now, because of that, have to work harder, which make you feel fatigued. Things like cigarette smoke, air pollution, cold air, and strong odors that we've discussed already about causes respiratory infections and can make your symptoms worse, okay? Now, the drugs that you have, you said that you don't really know how to work them well, but let me explain what those drugs are and kind of like how they work. So you have bronchodilators. This bronchodilator that you have will relax the muscles around your airways and help you breathe easier. Some work quickly for fast relief, and others work slowly, which will help you control your symptoms throughout the day. Okay. The corticosteroids that you have will help reduce inflammation and help prevent flare-ups. Some inhalers combine both medications into one device that you'll have to see what your doctor gives you, and we'll discuss on how that works, okay? Now, your rescue inhaler, this is not for daily use, okay? It is only for when you have sudden shortness of breath, okay? The devices that you're going to be given is you have an MDI and a DPI, okay? An MDI is a meter dose inhaler, requires a slow, deep breath in, okay? You're going to hold it for 5 seconds and then you can breathe out. How many breaths you take will be given on side of the medication vial that you're going to have. Now, when you do an MDI, the meter dose inhaler, you're going to have a spacer. The spacer is going to connect onto your MDI, which will help you disperse the medication throughout the lungs, and it'll give you a better outcome, okay? Now, your DPI it's a dry powder. So when you open it up, you're going to want to keep it flat and level, okay? Because if you point it down where the opening is down, that dry powder will then exit, and you don't want that. You need to breathe that in. So you're going to hold it flat. You're going to take a deep, strong breath in, and again, hold for 5 seconds, then you can breathe out, okay? Now we're going to, after discussing this, I'm going to explain how you're going to do it a little bit farther, and then you're going to show me how you're going to do it at home, okay? To ensure that you're doing it right. Now, pulmonary rehab is another key point in COPD. Okay, it includes exercise training, breathing techniques, education, and emotional support. The 2 breathing techniques that we're going to talk about today is going to be your pursed lip breathing. Okay, this is going to help you be able to exhale all of that air that's trapped within your lungs and help you breathe a little bit, reducing that air trapping. And then diaphragmatic breathing, which will help strengthen your diaphragm, okay? Now, pursed lip breathing, you're going to act as if you're like sucking through a straw like you're drinking. So you're going to close your lips like that, and you're going to breathe in, okay? And then you're going to breathe out. What that does is it makes you feel like you're breathing through a straw, which is going to lengthen your exhale and get that air trapping out. Your diaphragmatic breathing is, instead of breathing through your chest like most people do, you want to kind of like be like a baby. You want to breathe through your stomach, you know, like really working that diaphragm and breathing as deep in, okay? Now, I know this is a lot of information. At the end of this, I will be giving you a pamphlet. It's going to have all this information in it, okay? But we're going to start covering the barriers that we've talked about. So now we've already discussed that one of your barriers is you don't really know how to work your medication. Now, this is extremely common, so don't think too much about it. Don't get overly stressed about it. Most patients think that they're doing it right, but small mistakes can prevent the medication from reaching your lungs, okay? To help this, I'm going to show you how to work the MDI and DPI, and then you are also going to do it back. This ensures that I know that my teaching techniques are going to be done properly, okay? So the MDI, your meter dose inhaler, you're going to take the cap off, and then you have the spacer. You're going to put the spacer onto the MDI. Then what you're going to do is you're going to hold it up to your mouth, but you're not going to open your mouth yet and put it into your mouth. You're going to press on it, put your mouth on it, take a deep breath in, hold for 5 seconds, okay? The reason why you want to use the spacer so you're not getting things like thrush where it can really mess up your mouth and your backs of your throat, okay? Now, go ahead and do it. Let me see how you do it. Okay, now, the DPI, your dry inhaler, you're going to open it up, which will give you the amount of medication that you're going to get for every breath, okay? You're going to open it up, you're going to hold it flat to your mouth, you're going to take a deep breath in, and then you're going to hold for 5 seconds, okay? Now, go ahead and do it. Perfect. Now that we've covered how to do or administer your medications, okay, another barrier that we talked about a little bit gets a little bit touchy, okay, so don't worry about too much, but it's that your spouse smokes inside the house, okay? Now, even though that you aren't smoking, secondhand smoke can still irritate your lungs, okay? This causes trigger flare-ups and makes your COPD harder to control. I want to acknowledge that this is a sensitive topic, and I'm not here to judge. I understand that this is, you know, your thing and this is what you do, but there's some strategies that can help that we can include to make this a little bit better. And one of them is asking your wife to smoke outside. So at this point, I'd be talking to the wife, okay? Creating a smoking-free zone inside the home and exploring things like smoking cessation, which we'll talk a little bit later on, will both be able to help you as a spouse with someone with COPD, as well as making quitting together easier for you, wife, and helping the symptoms that your husband is having. A question for you is, how do you feel your spouse's smoke affects you or affects your breathing inside the house? Because understanding that your husband is having a little bit more symptoms from smoking inside can also help you understand and make it a little bit easier to help him in not smoking inside. And then as a team, both you and your wife, what changes do you think are both realistic in the household as well as accomplishable? Because what I don't want is to make a goal that won't be able to be really actioned on, and then it's just going to make you lose hope and lose the drive to be able to help both your husband in the managing of the COPD as well as make your team a lot more stronger. Okay, so now we're going to cover some SMART goals. What is a SMART goal? A SMART goal is a specific, measurable, achievable, relevant, and time-bound thing that you have to help with this situation, okay, with COPD. Now, My first goal that I want you to have is you are going to practice your inhaling techniques twice a day for the next 7 days. This is going to ensure that you are both having muscle memory, and you're ensuring that you're able to do it correctly, even if you're not doing it like your rescue inhaler. You're not going to need to do it every day, but you need to remember how to do it, so when you do it, you're doing it properly. Okay. Now, whenever you come back to your next appointment, I'm going to ask you to show me how you do your inhaler technique, so we can ensure that you're doing it properly. Okay. You and your spouse will create a smoke-free zone, okay, inside the home starting today. I'm not asking you to quit, because I understand that that's not realistic, it's not reasonable. But all I want you to do is smoke outside the home, which will help him with the symptoms and start to see how it affects him in a positive way, okay? So for the next 14 days, you'll only smoke outside the home. And at your next visit, we'll talk about how the adjustments will help both you and him. I want to keep you, another thing I want you to do is keep a diary. Inside this diary, I want you to describe how the medications are helping you, how the changes both of smoking outside the house, how that's been benefiting you, and how the inhaler techniques or your medication techniques have been improved upon, okay? Now, let's talk about how you're going to monitor your symptoms at home. Every day, pay attention to your breathing. It's going to be a little bit harder than usual, okay? Are you coughing more? Have your mucus color changed, or the amount, has it changed? Are you monitoring, are you more tired than normal, okay? These are going to be all the early signs that your COPD is getting worse, and so that's why I'm trying to make you identify and monitor that a little bit more, okay? You'll also follow up your COPD action plan, which I'll give you a whole sheet after we're done talking, and that sheet will have the entire action plan that you're going to be following, okay? And now, you're going to have different zones. Your green zone is just you breathing normal. It's just every day, you're not too bad, it's not shortness out of breath or anything like that, you're not tired, and you're just going to continue your daily medications, okay? Nothing big changed. Now, your yellow zone, you may notice a little bit more increased shortness of breath, more coughing, or trouble sleeping. This is where you're going to use your rescue inhaler as directed and contact your provider, okay? What I don't want you to do is get to the red zone, which I'll cover in a second, and it's too late, okay? That's not what we're trying to do. We're trying to manage your COPD symptoms and keep you on a regular, daily, healthy routine, okay? Now, the red zone, like I just said, that's where you're having severe shortness of breath, your blue lips or fingernails, or confusion. This is an emergency, okay? I need you to call help. This isn't where you can just hold off and you're like, oh, symptoms get better, let me use my rescue inhaler. You're a little bit too late for that, so I need you to call for help, call 911, and get emergency services, okay? Now, the additional resources that will help you through this journey together is we will set up with an appointment for your wife, because you've already said that you are okay with this and you want to help out. Your provider will help get you some help with smoking cessation support, and a program that will help you. I'll give you the contacts to the local COPD support groups and community groups. We'll schedule a follow-up visit in about 4 to 6 weeks. This will give you time to be able to work on that COPD plan, keep your diary, see how the changes are from smoking inside the house to outside the house, and how all of this affects your COPD management, okay? At that visit, we'll review your inhaler techniques as well, look at some of your symptom diaries and how that's changed. We'll talk about the smoking-free zone at home, like I said, and make any adjustments as far as your medications, okay? So if maybe your rescue inhaler is giving you side effects that you don't like, or your COPD management program isn't as effective as it should be, or you see some lulls within your program that we might need to critique, that's where we'll do that, okay? If there are any changes, or if we make any changes, or you need changes, please reach out, okay? We want to try to catch these problems early, so if there is something severe that needs to be changed now, just call me. I'll give you my contact information at the end of this so you don't forget it or anything, and we will make those changes accordingly, okay? Now, before we finish, let's quickly review everything we covered because I know we covered a lot. I know this is a lot of information, okay? So we talked about the COPD, why it causes symptoms like shortness of breath and coughing. Okay, we reviewed your medications, how each one works, and how to correctly administer them through the inhaler and the spacer and the MDI and DPI. Okay, we also talked about the two important barriers that we discussed: the not understanding or knowing how to really use your inhaler. Okay, and we also talked about trying to create a smoke-free zone. We talked. Together, we discussed the strategies to overcome both of those barriers. So hopefully this conversation and the support that I'm giving you and the information I'm giving you will help you with your symptoms. We went over how to monitor your symptoms day to day with your diary, what warning signs to watch for, how to follow your action plan and if your breathing gets worse. And finally, we talked about resources like your smoking cessation support and community programs that can help you stay on track, okay? Now, you're doing great. You're doing great learning and how to manage your COPD. Remember, you're not alone in this, okay? We're all here. We're a part of a team, both me, your primary care provider, your spouse, okay? We're all a team. We're here to support you every step of the way. If you need anything or any changes or you have any questions, reach out. I look forward to seeing you at your next appointment. Now, after all of that, we've discussed everything. Here's your step-by-step example on how to properly administer your inhaler and how to properly attach the spacer, because I understand that this is just a one-time. I taught you, and then you showed me that you know how to use it. But just in case if you forget, there's the step-by-step example. Okay, all contact information's on this sheet. So if you have any questions, if you need to contact me or your provider or the emergency services, here's the paper. The flyer for the community group that I told you about, here's their flyer with all of their information on it, as well as here's the paper for your COPD action plan, so there's no gaps or any places that we've missed that you might maybe forgot or haven't seen, like your rescue inhaler, like when to use it and things like that, okay, and everything we've talked about today. I promise, okay, I promise, fixing these few gaps, even the minute ones of like adding your spacer and stuff like that and monitoring accurately, this will help you a lot, okay, in managing your COPD. Now, you and your wife, you're both doing great, okay? Keep being a team, keep being strong, follow this plan, work together, and I promise this will help you, okay? Now you have a great day, and if you have anything, just reach out.